So this is the phase 1. This is the first in world clinical trial, treatment of the first patient. I've been at this for over 30 years, and this is the first time in my career I've been able to take a research breakthrough from the bench and now to the bedside, treating the very first patient in the world with this novel strategy. My name is Jim Rutka. I'm a neurosurgeon here at the Hospital for Sick Children, and this is the Arthur and Sonia Labatt Brain Tumor Research Center, the largest brain tumor research center of its kind for children. It is comprised now of over 125 individuals who are working on the problem of pediatric brain tumors. Last year when I spoke to the Bunzl group, I mentioned the research work that we had been doing that had been funded by the Bunzl Golf Tournament, and that research work was on a tumor type called Diffuse Intrinsic Pontine Glioma, or DIPG. The holy grail for all of us who work in medicine is to take something from concept or from the laboratory bench to a clinical trial. That happens actually pretty rarely that you're able to do that. But I'm very pleased today to announce to you that we've actually enrolled the first patient on this clinical trial, and this is the first patient in the world who has been treated for this disease with this technology called MR-guided focused ultrasound for the delivery of chemotherapeutics directly to the target, which is the brain tumor. A child with DIPG, which is a brainstem tumor, is diagnosed typically between ages 5 and 7. It's in a location of the brainstem which we cannot operate on directly. There's a blood-brain barrier that encases the entire brain that acts as a shield and preventing chemotherapy from being delivered across it to its target site in the brain. With that limitation, we've used this new technique of breaking down the blood-brain barrier using focused ultrasound that then allows the penetration of these drugs directly to the target site, because it's driven by the MR technology that allows us to be pinpoint and precise and accurate with the delivery of these drugs only to those areas of the brain that need it. There are associated risks potentially with this type of treatment, the most feared of which is bleeding after the procedure. And each treatment was extremely well tolerated without any side effects or complications, which to all of us was a huge relief for this large team that was treating this child. That to me was the most gratifying part of this, is that we could focus with absolute precision in a young child the chemotherapy to its target site. Now what we want to do is to follow this child, but enter another 9 children total, because the trial is set up to enter 10 children in this first phase 1 clinical trial. We've had notifications, emails, text messages from physicians, surgeons, parents and families from around the world who have heard about our trial, and they all want to come in and join this trial. I think over the course of time we'll be opening up this trial worldwide. So it's quite feasible that we'll get to that 10 patient mark before we know it. After this phase 1 trial is completed, we'll be moving on to what's called a phase 2 study, which then asks the question specifically about the efficacy. So once you've proven safety and feasibility, you can move to ask the question about, is the drug or chemotherapeutic you're using effective against this disease? Bunzl has been amazing in its support of our research efforts over more than 20 years now. And it's supported the basic science research, which is pivotal. It's instrumental for us to do these types of clinical trials. Without that support, we wouldn't be talking about going from concept to clinical trial as we can today. Future funding from Bunzl will go towards us identifying other targeted agents that might be used in subsequent clinical trials with MR-guided focused ultrasound as a platform that we can use to deliver a highly targeted therapy to these malignant brain tumors in children.